Hi, everybody. This is Lee, and I'm talking about the Medicare for all situation. It looks like the concept of single payer is entering the mainstream, that even conservatives are discussing it as a serious issue instead of dismissing it outright, and that people are becoming more and more aware of it. Even the fact that Donald Trump has been dropping little hints now and then that he supported it in word and written word, and then publicly in interviews. President Donald Trump did from 1999 to 2015. And then 2016, he distanced himself during the campaign for president. He distanced himself from the concept of single payer. And then 2017, this year, a few days ago, he praised Australia's healthcare system, which is universal healthcare. So that's Canada, Scotland, Australia. He praised all three of their healthcare systems, which are universal healthcare systems. And the fact that even a conservative talk show host, Charles Krauthammer, discussed single payer, saying that it was on the horizon, that was inevitable. And so it's, getting, I wouldn't say bipartisan, but it's crossing party lines all the way from the progressive wing of the Democratic Party across the center into the conservative aspect of the political spectrum, that people are actually treating it as a serious issue, which is great. I've been sending out letters to the editor because I said I want to make sure to reach more populations. I found templates on, I believe it was pnhp.org, Physicians for a National Healthcare Program. They have a lot of great resources. If you want to try to do that, send out letters to the editor. You'll find some great templates there. And then also health over profit, lots of worksheets and discussion points and things like that to help people understand the policy. And that it ranges from very simple words all the way up into complex discussions of how it works. And so know your audience based on who you're talking to. That's how you explain it. That while you have like a lot of complex things going on in your head, you have to know your audience and how to speak to your audience. If whether it's the newspaper audience that's going to read your letter, it has to be at the level of the rest of the newspaper, which is, I believe, high school, maybe 12th high school level, something like that, 8th through 12th grade level education. That's the level that you write it. So you write for your audience. If you're talking to maybe a group of PhD and economic professors, you discuss it a different way. So you have to know people, be able to interact with them, discuss things with them, and then target your language so that they understand what you're saying. And so based on who you're talking to, and I say that most importantly because Nancy Pelosi of the Democratic Party just came right out and said, like, we will not be bringing single payer to the floor. It's not going to happen. And she's in a state, California, that's considering single payer, the state bill. So even though Nancy Pelosi's own state of California is considering single payer for its own state, Nancy Pelosi's like, no, I'm not bringing it to the floor in Washington. Not going to happen. And she said that back in during the 2006, and then also during the first years of Barack Obama's term, when the Democrats had control of the houses and they could have passed single payer, they didn't do it. And so we have to take Nancy Pelosi at her word that she's just not going to do anything to assist this along. We have to look at Dianne Feinstein, and she's basically stated that she's not going to work on that either. And so California, is working on its own single payer plan despite their political leaders opposing them and fighting them at every turn. So at the state level. And so some states are doing it. Hawaii is actually considering a single payer health system. Vermont tried it and was working on it until I guess the Obama administration said, no, you're going to use Obamacare is what you're going to do. And so it's being considered at the state level, and that there are state legislatures working on these bills. And so it's possible to do that. it's maybe not as financially feasible, but you do what you have to. And this is the same with medical marijuana and even recreational marijuana. It would be so much easier to reschedule it at the federal level with the executive, administration just saying we're going to reschedule it, and they said no, we're not going to do that. And so it's been state by state by state. And I think we're up to 30 states with West Virginia. Ultra conservative states are saying, like, you know what, we're just going to have to do what we have to do because our federal government is failing us. And so it's the same with single payer, that many people are trying to persuade Nancy Pelosi, and it's looking like she's like, no. Just like I said 11 years ago, no. And so it may be that it has to be done at the state level in other states besides California and Hawaii. And so it may go through the state legislature. You may be able to lobby your state legislature in order to convince them to write this bill and bring it up for a vote. And, some states, are leaning that way to where that can be done. Other states are more conservative, but anything is possible. Like I said, West Virginia just legalized medical cannabis, and Arkansas has as well, and I believe Louisiana is the other southern state that has. And so if your state legislature is conservative to the point that you don't think you can get single payer brought up, I mean, it doesn't hurt to try. I would say go ahead and try, but if it doesn't come to the floor, then a ballot measure may have to be done. Colorado tried a ballot measure. It was defeated by a lot of spending against it by large corporations involved with the health industry. The corporations killed that ballot measure. But you have to do what you have to do. And so if your state legislature does not listen to you or doesn't bring it to the floor for a vote, then you might have to go to your fellow citizens and bring it to them. And so that's why I say it's very important to know how to speak to people, to explain the concept of what single payer is, and then show them the benefits of it, how other nations are using it, the cost feasibility, the direct benefit to them, how their lives will be better, and things like that. All these resources are healthoverprofit.org. I'll put the link in the description, or Physicians for a National Health Policy, and I'll put that link in the description too. There's economic discussions by PhD in economics at Amherst, University of Massachusetts at Amherst. I'll put that link in the description. So you'll have a lot of tools. If you decide to either lobby your state legislature, you can just digest that information and then speak to your state legislature. You speak to them one way. Or if you decide you want to talk to your fellow voters, then you find a way to speak to them. You know your own people, so you speak the way your people would want to be listened. However you can get them to listen to you. That's what you do. And so also, because you'll be knocking on doors. You don't know, you have to wait to see who opens the door and then speak to the person. So whatever level that they're at, you bring your discussion up or down, or, left or right, however you have to come about it in order to get the point across. And then also, if you're writing letters to the editor, you'll have a lot of information to use. And so that's what I recommend, that people continue to find ways around the blockades that have been set up, that there are workarounds, that some states are working on it and, working at the federal level. I think that's still advisable. The campaign to replace our Congress, I think that's advisable as well. And then also campaigning at the state level to actually get people into the state legislatures that are single payer friendly. And then, of course, campaigning amongst your own community, lobbying your own friends and neighbors in your community. That's advisable as well. And there are many ways to do it. And I say good luck to you.